are you okay? Marty.
Are you choking? I'm an emergency responder. May I help you? All right, take it easy.
Wait a minute. Do you need help?
Hey, Kevin, are you all right?
Jimmy, come here quick.
Susie, go call for help.
My neighbor just collapsed. Can you please send someone over?
My name is Eileen. I'm an emergency responder. May I help you?
Are you okay?
Medical emergencies and accidents happen every day.
Hey, Susie, can you call for help? Bring a first aid kit. Kevin, it's Steve.
At home, while commuting, at work, and during recreation. They're an unfortunate but inevitable part of life. Usually the first person to help is a layperson, friend, co-worker, or passerby. Someone like you. There are no guarantees, of course, but by applying some basic knowledge and skills as an emergency responder, you can do everything reasonably possible to produce a favorable outcome for the patient. You learn these basic skills in the Emergency First Response Primary Care, CPR, and Secondary Care, First Aid courses. Emergency First Response Primary Care, CPR, prepares you to aid patients with life-threatening emergencies. You learn the same emergency care priorities medical professionals use. Emergency First Response Secondary Care, First Aid, builds upon what you learn in the Primary Care course. In that course, you learn to give aid for medical emergencies that aren't immediately life-threatening. Emergency First Response Primary Care, CPR, and Secondary Care, First Aid courses follow emergency considerations and protocols as developed by the various members of ILCOR, the International Liaison Committee on Resuscitation. Although Emergency First Response is an internationally based course, local variation in skill technique, first aid procedures, terminology, requirements, and course flow may exist. Your Emergency First Response instructor will guide you. In Emergency First Response Primary Care, CPR, you learn 9 essential skills that link together when you help someone in a life-threatening emergency. Skill 1. Scene assessment. Skill 2. Barrier use. Skill 3. Primary assessment. Skill 4. CPR chest compressions. Skill 5. CPR chest compressions combined with rescue breathing. Skill 6. Serious bleeding management. Skill 7. Shock management. Skill 8. Spinal injury management. And Skill 9. Conscious and unconscious choking adult. You may also learn other optional primary care skills, such as automated external defibrillator use and emergency oxygen use. In Emergency First Response Secondary Care, First Aid, you learn what to do when emergency medical services, EMS, are either delayed or unavailable. Secondary care skills include Skill 1, Injury Assessment. Skill 2, Illness Assessment. Skill 3, Bandaging. And Skill 4, Splinting for dislocations and fractures. This video covers the skills for both courses. After watching the skills demonstrated in the video, your instructor will have you practice the skills. After you've learned to perform and sequence the skills, you'll get to practice them in simulated emergency situations. This teaches you to adapt your emergency responder skills to real emergencies.
Are you okay?
A medical emergency arises. As an emergency responder, you know that if you assist, you can save or restore a patient's life. You can reduce a patient's recovery time. And you can make the difference between a temporary or lifelong disability. Even knowing this, sometimes people hesitate to help. Even people with CPR and first aid training. They may feel anxiety or guilt about the situation. Sometimes they're afraid they'll do the wrong thing. They fear imperfect performance or making a person worse. In some societies, people are afraid they'll get sued if the situation doesn't work out right, and there's the fear of communicable diseases. As an emergency responder, realize that none of these concerns need prevent you from helping in a medical emergency. Let's look at why. First, let's look at the fear of infection. You may hesitate because you are afraid of being infected by the person you are assisting. This is a concern, but remember your training includes learning to use protective barriers to minimize the risk of disease transmission. By using barriers, you're highly unlikely to get any disease or infection from someone you help. Second, focus on helping, not perfection. You want to do the best you can, but it's unlikely a minor error will make much difference, much less hurt or kill a patient. Focusing on perfection tends to make people hesitate in a real emergency. Do not hesitate. Help. Remember, adequate care provided is better than perfect care withheld. Third, learn to trust your training. During the scenarios, you'll find that what you think you forgot comes back when you provide aid. At first, things feel awkward. Then suddenly you've got it, like getting back on a bicycle after not riding one for years. Remember this feeling. You can trust it in a real emergency. Fourth, be decisive and act. Usually there's more than one right way to handle a situation. Circumstances don't always provide clear direction. Start helping immediately. To help you be decisive and act, Emergency First Response has developed an easy-to-use prompt to remind you of the important steps needed to assist someone in need. The Emergency Care at a Glance Decision Guide provides you with comprehensive primary and secondary care directions. This is a must-have addition to your first aid kit at home and on the road. Fifth, you may be concerned about your responsibility when helping another in need. You may hesitate because you're afraid of being sued. In general, the fear of being sued should not stop you from providing emergency care. Many countries have Good Samaritan laws which simply say that as a layperson helping another, you cannot be successfully sued if ultimately things don't work out well for the patient. Your training in this course will show you how to provide help within the protection of these laws. Good Samaritan laws will generally protect you if you provide care within the scope of your training as an emergency responder. Ask for permission to help. Act in good faith. Are not reckless or negligent. Act as a reasonably prudent person would. And don't abandon the patient once you begin care. The exception is if you must do so to protect yourself from imminent danger. Finally, don't worry about making a person worse. The most serious medical emergency is when a patient is unresponsive and isn't breathing normally. Sometimes people hesitate to help such a patient, fearing they'd make him worse. As an emergency responder, realize that you cannot make such a person worse. A person who is unresponsive and isn't breathing normally is already in the worst state of health.
Hey, I need some help here.
Again, remember you cannot make the person worse, but you may be able to help this person.
Call for help and bring an AED. Okay. He's not breathing.
You don't need to fear providing rescue breaths and chest compressions. You can trust your training. Take a moment to relax, think of your training, then step forward and help. CPR, cardiopulmonary resuscitation, helps to oxygenate the body when the heart isn't beating. You do this because if CPR begins soon enough and if emergency care arrives quickly, then it may be possible to restart the patient's heart. CPR won't usually restart the patient's heart. Instead, it extends the period during which it may be possible to restart the heart.
Take it. Todd.
Realize that
Richard.
CPR doesn't guarantee that the patient's heart will restart. In fact, most of the time, even with CPR, it doesn't restart. This means that you can never know whether providing CPR or any other aid that's called for would have made a difference unless you step forward and provide help. If you provide CPR and the patient's heart doesn't restart when medical care arrives, realize that you did everything humanly possible. But if you could have provided CPR and didn't, you may spend the rest of your life wondering whether it would have made a difference. Don't let that happen. Trust your training and help. Remember, adequate care provided is better than perfect care withheld.
One of the things that I want to emphasize is we're here.
While you are taking this course, don't be intimidated. Naturally, you'll make mistakes during the course. It's a normal part of learning. So if you make one, just adjust and try again. You'll have plenty of time to practice, build your confidence, and be ready to help someone in an emergency.
Perfect.
Also, have fun. That may sound odd considering the seriousness of what you're learning, but you'll learn more and learn faster when you enjoy the learning process. Keep it light.
Very good.
Your ability to use a skill effectively weakens when you don't use it for a while, but once you've learned it, it comes back much easier than learning it the first time. The more recently you practice a skill, the easier it comes back. The same is true for your emergency first response skills. Hopefully you won't need them often in real emergencies, so you want to practice to keep them fresh. Here's how. First, watch this video from time to time so you remember the skill steps and the information that relates to using them. Second, run through practice emergencies with other emergency responders in your family or among your friends. Try to get some CPR practice. If you don't have a CPR mannequin, use a stuffed sack that's the right size or even a pillow. But never practice CPR chest compressions on a person. Doing so can interfere with the person's normal heartbeat. Finally, refresh your skills with an instructor in the Emergency First Response Primary Care, CPR, and Secondary Care, First Aid, refresher course at least every 12 to 24 months. When you complete the update, you'll receive a current Emergency First Response completion card. When you recognize a potentially life-threatening emergency, you help with the first 3 links in the chain of survival. Link 1 is early recognition and call for help. Link 2 represents early CPR. The third link is early defibrillation. The fourth link, early professional care and follow-up, is for professional health care providers. In a life-threatening emergency, early professional care is very important. The sooner emergency medical professionals arrive, the better the outlook for the patient. The emergency responder does not replace professional emergency medical care. In the chain of survival, your role as the emergency responder is to summon emergency medical aid and to assist the patient until it arrives. Activating EMS is so important that in most circumstances, if you're alone and there's no one else to activate the EMS for you, you call first, then assist the patient. An exception to the call first rule is if the patient is a child or an adult who has experienced submersion in water. In these cases, you provide CPR for a short time, particularly rescue breaths to the patient, and then call EMS. This is called care first rather than call first. The various resuscitation councils define providing CPR for a short time differently. Some define a short time as providing a minute of care, and then some define it as 2 minutes. Your instructor will guide you. With EMS on the way, the care you provide increases the chance that advanced care will help the patient when it arrives. Your training in this course is based on handling emergencies where you have an emergency medical system. If you need to provide emergency aid in areas away from EMS support, you should continue your education with more advanced first aid training. Providing emergency care can be very stressful. After the incident and after the emergency medical professionals take over, it's time to take care of yourself. You may wish to talk about the event to a friend or family member. You may find the situation upsetting, especially if things didn't work out well for the patient.
Still, I feel like I let him down. I mean, what about his family? I feel like I let them down too.
Talk to someone if it helps, including a healthcare professional if necessary. But remember that as an emergency responder, your training only gives those you help the best chances possible, not promises nor guarantees of medical miracles. No matter how it works out for the patient, feel good about the fact that you reached out to help another.
All right. Maybe you're right. Maybe doing something is better.
Before helping someone, it's important to ask for permission to help. You do this with the responder statement.
Okay, I'm an emergency responder. May I help you?
Yes, please.
You simply say, "Hello, my name is," your name. "I'm an emergency responder. May I help you?" It's important to get the patient's agreement if he is alert and responsive. If a patient is unresponsive, give the responder statement anyway.
My name is Christopher. I'm an emergency responder. May I help you? Are you okay? Are you okay?
If the patient can't answer, most laws assume implied consent. This means the law recognizes that in a serious situation, the patient would almost certainly want help.
I have an emergency. I have a man down.
Laws vary from one region to the next, so check those that apply to you.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
If an adult refuses your help, don't force it on her. Instead, talk to the person, stressing the need for care and monitor her condition without providing actual aid. Depending on the situation, however, you could activate EMS at this time. Have you ever wondered how medical professionals know what to treat first when they help someone? They use a cycle of care to sequence treatment and monitor a patient's medical status. Using the memory word ABCABS, the cycle of care speaks directly to a pathway of priorities for emergency care. By learning the memory word ABCABS, you'll know what to do first, second, third, and so on when a person with a life-threatening illness or injury needs your assistance. You'll practice using the memory word ABCABS in a cycle of care as you learn emergency first response skills. The meaning of the memory word ABCABS is as follows. Within the AB portion of the memory word, the first A in ABCABS stands for airway. Essentially, the A reminds you to ask the question, is the patient's airway open? Also, within the AB portion of the memory word, the first B in ABCABS stands for breathing. This letter reminds you to ask the question, is the patient breathing normally? In the cycle of care, you begin by initiating a very quick check of the patient, attempting to answer these two questions. Is the patient's airway open, and is he breathing normally? If the patient's airway is open, but he's not breathing normally, then you call emergency medical services and quickly move into the cycle of care.
1, 2, 3, 4, 5, 6, 8, 9.
Within the memory word ABCABS, the CAB portion of the word reminds you how to perform CPR. Let's see how. CAB stands for chest compressions, airway open, and breathing for the patient. When a patient's not breathing normally, you must act immediately to provide chest compressions.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
After
17.
chest compressions, you open the patient's airway and then breathe for the patient. As defined earlier, this is how CPR is administered. After breathing for the patient, you continue to move through the cycle of care by returning back to chest compressions, opening the airway, and breathing for the patient. You continue with the cycle of care until professional help or an automated external defibrillator, AED, arrives. More on AEDs later. If the patient is breathing normally, you move along the cycle of care to the S portion of CABS. The S in CABS reminds you to look for and treat serious bleeding, shock, and spinal injury. In this course, you'll learn how to manage each of these medical emergencies. When you come across a possible medical emergency, what's the first thing you do? It may surprise you that the first thing you do is think about yourself. You need to protect yourself. This is for the sake of the person needing help as well as for yours. After all, if you get hurt, you can't help. Assessing a scene is the process of looking for and avoiding any dangers at the scene of a medical emergency. It's the first thing you do and the first skill you'll practice. Scene assessment takes 3 steps. 1. Stop. 2. Think. And then 3. Act. Stop and assess the scene for hazards. Ask yourself, what caused the injury? Are there any hazards? Look for potential hazards such as leaking gas, chemicals, radiation, downed electrical lines, fire, firearms, the possibility of explosion, or oxygen depletion. Can you make a safe approach? Consider how to make a safe approach. Be alert for possible dangers, such as oncoming traffic. Do you need to turn off a car's engine? Apply barriers as appropriate and if available. Next, think. Formulate a safe action plan. Can you remain safe while helping? Remember that your safety must be the first priority. Know your limitations. What emergency care may be needed? How can you activate local emergency medical services? Can you locate an AED? Can you have bystanders activate emergency medical services or locate an AED? Think about your training and relax. Now act. Begin providing care. To act, follow the emergency care guidelines you will learn in this course. As you help, follow the emergency first response skill sequence of priorities. But scene assessment and taking care of yourself never stops. Ensure your safety so you can help others in need. Earlier, you learned that some people fear infection and therefore hesitate to help others in medical emergencies. The diseases of most concern are those transmitted through blood and other body fluids. These are hepatitis B and C and the human immunodeficiency virus, or HIV. As an emergency responder, you can greatly reduce infection risk by applying barriers. Barriers include gloves, ventilation shields, ventilation masks, face masks, and eye shields. Gloves and ventilation shields or masks are useful during CPR. Gloves, face masks, and eye shields are useful barriers when exposed to body fluids such as blood. As important as they are, however, do not delay emergency patient care if barriers are not available. Research has shown that the chance of disease transmission is very rare when providing CPR. Nevertheless, you can minimize the risk of infection by always placing a barrier between you and the body fluids of the injured or ill person. Like scene assessment, barrier use is a skill that usually comes before you start helping the patient. Remember to begin with Skill 1, scene assessment. Stop, think, and then act. As you are assessing the scene, put on gloves if you have them. Put the gloves on carefully to avoid tearing. Removing your gloves once you have finished treating a patient is a bit more involved. Your objective is to remove them so that you don't spray or spread body fluids. To remove the first soiled glove, carefully pinch the outside portion of the glove at the wrist, like this. Next, Gently roll the glove off so that the outside portion is turned inside. Hold the removed glove with the gloved hand like this. To remove the remaining glove, place the ungloved hand under the glove at the wrist, next to the skin, and roll off in the same manner. To finish, roll this second glove off and around the previously removed glove, like this. Finally, place the gloves in a biohazard bag for disposal according to local guidelines. Your instructor will show you how to use one or more of the different ventilation shields or masks available. These barriers trap or isolate you from moisture or fluids from the patient's breath and mouth during the rescue breathing step of CPR. Barriers take up little room, so it's easy to keep a set handy at all times. But remember, the chance of disease transmission is very rare when providing CPR. The risk of infection may be even lower if you're helping someone who has a medical history you know, like a family member. Therefore, you may not need to withhold aid just because you don't have a barrier. You've assessed the scene, and perhaps you've applied your barriers. Now you're ready to begin primary assessment. Primary means first in a series or sequence. Assessment is an evaluation or an appraisal. Primary assessment helps you recognize life-threatening conditions and prepares you to provide priority emergency care. By conducting a primary assessment, you will be able to answer the questions: is the airway open? And is the patient breathing normally? This is the AB portion of the ABCABS memory word. After you conduct a primary assessment, you proceed immediately to attend to any life-threatening conditions you discover. No matter what the patient's situation when you arrive, you begin with a primary assessment. Primary assessments all follow the cycle of care sequence that speaks directly to a pathway of priorities for emergency care. Throughout an incident, you continually monitor the patient and use the cycle of care to guide you, ready to provide assistance based on what you learn from your assessment. Watch this emergency scenario, noting how the cycle of care guides the rescuer. After the scenario, we'll review how the rescuer applied each step.
Hello? Ricky? It's Evan. I'm an emergency responder. May I help you? Ricky? Ricky, are you okay? You okay? Yeah, my friend just collapsed. He's not breathing and he's unresponsive. 3234 Tomas Street. Yes. Thanks. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
The cycle
17,
of care
18, 19,
answers
20,
all
21,
questions
22,
about
23,
what
24,
injuries
25,
or
26,
illnesses to treat first. For instance, suppose a patient has serious bleeding and doesn't appear to be breathing normally and is unresponsive. What do you do first? Easy. The cycle of care guides you. First, you assess the scene. Make sure it's safe for you to approach the person in need. Then quickly seek answers to the questions. Is the patient's airway open? Is he breathing normally? To do this, first open the patient's airway and then quickly check for normal breathing. This patient isn't responsive or breathing normally, so if you're alone, you need to call emergency medical services. Next, immediately begin chest compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After giving chest compressions, open the patient's airway and begin breathing for the patient. Chest compressions and rescue breaths, CPR, takes priority over serious bleeding. ABCABS and the cycle of care correctly leads you through the priorities of care. In this scenario, you deal with the fact that the patient is unresponsive and is not breathing normally before you treat his serious bleeding. If the patient begins to breathe normally and becomes responsive, then you can attend to his serious bleeding. Let's look at primary assessment, first with a responsive patient and then with an unresponsive patient. A responsive patient is one who is alert and able to answer questions. Begin with assessing the scene. Stop, think, then act. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? Because responsive patients are talking or making noises other than gasping, you've verified that their airway is open and they are breathing normally, the first two steps in the cycle of care. This patient is responsive and is breathing normally, allowing you to skip over the CAB portion of the cycle of care. There's no need for chest compressions, opening an airway, or breathing for the patient. Keep the patient still. Do not move the patient unless you or the patient's safety is compromised. Put on barriers if immediately at hand. However, don't delay emergency care if barriers are absent. Next, check for serious bleeding, shock, and spinal injury. As you move through the cycle of care, alert the emergency medical service if you find any serious medical condition. Now let's look at the primary assessment with an unresponsive patient. An unresponsive patient is one who is either completely unconscious or one who may be partially conscious but incapable of response. Begin again by assessing the scene. Stop, think, and then act. Make sure it is safe to help the patient. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? This patient doesn't respond to your statement, so tap him on the collarbone to further check responsiveness. While tapping the patient, ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing. If you are unsure if the patient's airway is open or if he is breathing normally, quickly open the patient's airway using the head tilt chin lift. To perform a head tilt chin lift, first place your hand on his forehead. Next, place your fingertips under the point of his chin, like this. Finally, gently tilt his head back and lift his chin. Another method of opening an airway is the pistol grip, like this. When the patient's airway is open, check for normal breathing. To do this, look for chest movement and listen for breathing sounds. Also, with your ear next to his mouth, feel for expired air on your cheek. This check for normal breathing must be accomplished quickly. If the patient is not breathing normally, he needs CPR immediately. Avoid long delays. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. This unresponsive patient is breathing normally, so continue your primary assessment by checking for serious bleeding, shock, and spinal injury. If a spinal injury is suspected, keep the patient's head, neck, and spine immobilized and do not move the patient. If no spinal injury is found or suspected, and you may need to leave the patient, place him in the recovery position. The recovery position allows the patient to breathe easier since there is little pressure on the chest. It also decreases the risk of something blocking his airway and allows fluids to drain should he vomit. To put an unresponsive breathing patient in a recovery position, first position the patient's arms like this. Next, grab the patient's far leg just above the knee and pull it up, keeping the foot on the ground, like this. Now, gently pull the patient towards you, putting him on his side. Once on his side, place the patient's lower hand near or under the neck for stabilization. If need be, gently pull back on the patient's head to assure an open airway. If the patient has to be kept in the recovery position for more than 30 minutes, consider turning the patient to the opposite side to relieve pressure on the lower arm. When a patient stops breathing normally and his heart is beating erratically or not at all, you can substitute manual chest compressions for the heart's normal pumping action to circulate blood through the body. The blood you push through the patient's body will carry some oxygen to important organs. Your willingness to respond may increase the patient's chance for survival until emergency medical service personnel arrive. CPR is a two-step process. Step 1, chest compressions, followed by Step 2, rescue breathing. In this skill, you'll learn how to perform chest compressions. If you are unable or feel uncomfortable giving a patient the rescue breaths, relax. Give the patient immediate and continuous chest compressions. Chest compressions alone are very beneficial to an unresponsive patient who is not breathing normally. Your efforts will still help circulate blood that contains oxygen. Begin, as usual, by assessing the scene for safety. Next, check the patient for unresponsiveness by giving the responder statement.
Hello, my name is Penny.
If there is no response to your statement, then tap the patient on the collarbone and ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing. Here's an important note about normal breathing. In the first few minutes after cardiac arrest, a patient may be barely breathing or taking infrequent, noisy gasps. This is often termed agonal breathing, and these gasps must not be confused with normal breathing. Many patients in cardiac arrest make these gasping sounds. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical services, then you provide assistance.
1, 2, 3, 4, 5,
Now, position the patient on his back if not already in this position. If necessary, expose the patient's chest. Find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers. Use the palm of your hand on the compression site. Keep your fingers off the patient's chest. Next, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows, like this. Now deliver the chest compressions. Keep the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters, 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4 and so on for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. With your instructor, you will practice chest compressions using a CPR mannequin. Do not perform chest compressions on someone who does not need CPR. As you've learned, chest compressions alone are very beneficial to a patient who is unresponsive and not breathing normally. However, if you are also willing to provide rescue breaths to a patient in need, you may further increase the patient's chance for survival until emergency medical service personnel arrive. After completing this skill, you should trust your training and provide an unresponsive patient who is not breathing normally with complete CPR, chest compressions, and rescue breathing. As always, begin by assessing the scene and give your responder statement.
Hello, my name is Juanita. I'm an emergency responder. May I help you?
Next, tap the patient on his collarbone and ask,
Are you okay? Are you okay?
After you deliver your responder statement, quickly open the patient's airway and check for normal breathing. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. As in the previous skill, find the compression site by putting the heel of one hand in the chest center. On some individuals, this position is between the nipples. Place your other hand on top of the hand already on the chest and interlock your fingers, like this. Now, position yourself so that your shoulders are directly over your hands and your arms are straight. Lock your elbows. Now deliver the chest compressions. Keep the force of the compressions straight down and avoid pushing on the rib cage or the lower tip of the breastbone. Allow your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the patient's chest, at least 5 centimeters, 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat at a pace of 1, 2, 3, 4, and so on for 30 chest compressions. Perform the compressions as fluidly as possible. Your rate should be at least 100 compressions per minute. The rate is a lot faster than most people think. Push hard and push fast. After delivering 30 chest compressions, quickly position a ventilation barrier on the patient and open the patient's airway. To open the patient's airway, you will use the head tilt chin lift. First, place your hand on the patient's forehead. Next, apply firm backward pressure with the palm of your hand, tilting the head back, like this. Place the fingers of your other hand under the bony part of one side of the lower jaw near the chin. Avoid pushing directly under the chin. Lift the jaw upward to bring the chin forward. This immediately opens the airway. Now, with the patient's head tilted back and the ventilation barrier in place, begin your rescue breaths by pinching his nose closed. Give 2 rescue breaths, with each lasting about 1 second. Provide the patient with just enough air to make the patient's chest rise. Look for this rise in the patient's chest. If you can't make the patient's chest rise with the first breath, repeat the head tilt chin lift to reopen the airway before attempting another breath. Improper position of the head tilt chin lift is the most common cause for not being able to inflate a patient's lungs. Do not try more than 2 rescue breaths to make the chest rise. Minimize delay between chest compressions. After 2 breaths, whether they make the chest rise or not, begin chest compressions again. After delivering 2 rescue breaths, immediately begin another cycle of 30 compressions. Continue alternating 30 compressions with 2 breaths until emergency medical service personnel arrive. You can defibrillate using an automated external defibrillator. The patient becomes responsive and begins to breathe normally. Another emergency responder arrives and takes over your CPR efforts. Or lastly, you are too exhausted to continue. If more than one emergency responder is present, consider alternating care. To avoid fatigue, each provider can deliver CPR for 2 minutes and then switch. While switching providers, minimize chest compression interruptions. At this point during your training, your instructor may introduce you to the use of an automated external defibrillator, or AED. As you just learned, CPR is an emergency measure that can extend the window during which it may be possible to restart the heart. During this window of opportunity, you want emergency medical services personnel to be on their way to your location. This is why it's important to first call emergency medical services when a patient is unresponsive and not breathing normally. Qualified personnel can provide advanced cardiac life support to the patient. They can help the patient with drugs, artificial airways, ventilation devices, and defibrillation. Defibrillation is the process of restarting an erratic heart. Natural electrical impulses control your heartbeat. When these impulses fail, the heart beats erratically and no longer pumps blood. This is called fibrillation or twitching. Defibrillation administers a shock that momentarily disrupts the erratic signals and allows the normal heartbeat to return. As time passes, the probability of defibrillation restoring the heartbeat goes down. The benefit of prompt defibrillation was the reason for the development of easy-to-use automated external defibrillators, or AEDs. With AEDs, you no longer have to wait for emergency medical services personnel to defibrillate a patient's heart. AEDs can be used by lay rescuers like you. An AED is a portable machine that automatically delivers a shock to a patient who is not breathing normally and whose heart has stopped beating or is beating irregularly. All AEDs function in the same basic way. First, you turn the AED on by either opening the unit or pushing the appropriate button. Next, connect the AED to a patient via 2 chest pads. When the AED is turned on, its computer analyzes the patient's need for a shock. If the AED detects a heart rhythm in need of a shock, the machine will indicate that a shock is advised. Depending on the type of machine, either the emergency responder shocks the patient or the machine does so automatically. To effectively treat heart fibrillation, you must be able to rapidly integrate CPR with the use of an AED. To give a patient the best chance of survival, 3 actions must occur within the first moments of a cardiac arrest. First, activate the emergency medical services system. Second, provide immediate CPR. And third, use an AED. These 3 actions are all part of the chain of survival. If a bystander is available while you provide the patient with CPR, have them call emergency medical services and retrieve an AED. Further, bystanders can set up the AED and apply the chest pads while you continue CPR. Overall, both of these bystander actions allow you to minimize interruptions in CPR.